Walk onto any modern hospital floor, and the first thing you notice is the velocity. Call bells ringing, monitors chiming, and a constant rapid-fire blur of medical personnel moving from room to room. You spend years mastering the science of this environment. You learn exactly how to nail a difficult IV start on the first try, and you train your eyes to catch the most subtle, dangerous shifts in a patient's vitals. Yet, despite that high-level clinical mastery, a strange pattern urges. Within 24 months of graduation, many of these highly trained professionals hit a wall of absolute exhaustion, dreading the drive to work before their shift even begins. The immediate response is almost always internal. You look around the ward, feel the weight of the burnout, and assume the problem is you, wondering if you simply aren't cut out for the realities of the job. When technical expertise fails to prevent this level of exhaustion, it suggests a breakdown that clinical training never prepared you for. It points to a pressure point that hospital monitors can't track. To understand what is actually happening, we need to look at a massive dataset recently compiled by Expert Compass, which analyzes the specific factors that lead to long, healthy nursing careers. This chart plots clinical skill level against career longevity. If excellence protected you from burnout, we would see a clear upward line. Instead, the distribution is entirely random. Notice the data clustered in the bottom right quadrant. These absolute best clinicians are burning out the fastest. Because the clinical data strictly contradicts the career outcomes, the answer is clear. The root cause of this burnout epidemic exists entirely outside of a nurse's clinical capability. We have to zoom out from the patient bedside and look at the broader, complex ecosystem of the hospital as a workplace. The problem stems from a specific knowledge gap, what Dr. Pio calls the invisible curriculum. This animated scale illustrates the imbalance. Nursing schools do an excellent job teaching the visible curriculum, filling this heavy side of the scale with anatomy, pharmacology, and standard patient care protocols. But the other side of the scale remains completely empty. Students are never taught the actual business operations or the complex cultural dynamics of the healthcare system they are about to enter. That omission creates a massive, dangerous gap between knowing how to be a good clinician and knowing how to survive a demanding healthcare environment. The invisible curriculum breaks down into 3 distinct, absent skills. The first is the ability to identify and safely navigate a toxic unit culture. The second is managing complex workplace politics, communicating effectively with both peers and hospital administration. The third, and arguably the most crucial, is the strict requirement of setting and holding firm emotional boundaries. This flowchart demonstrates the mechanism of failure. When a high clinical workload encounters a nurse without a boundary-setting interceptor, the daily stress bypasses all mental safety checks and dumps directly into severe burnout. The workplace systematically dismantles a great clinician because they lack these specific professional antibodies. These elements of the invisible curriculum are not optional soft skills. They are the strict, necessary armor required to protect your long-term career. Now that we have the correct diagnosis, the standard treatment plan for career stagnation has to change. Acquiring another clinical certification or degree will never solve a cultural or political problem. It simply adds more clinical weight to an already unbalanced scale. You are not broken, and you have not chosen the wrong profession. You are a highly capable professional who simply wasn't given the correct roadmap for the business side of healthcare. The goal has to shift away from merely trying to survive your next 12-hour shift toward strategically architecting a protected, sustainable career. To build that roadmap, Expert Compass developed a targeted intervention, the Toxic Culture Survival Framework. Applying this framework builds a concrete career plan designed specifically to protect 2 things: your paycheck and your peace of mind. The most direct method for learning and implementing this strategy is through one-on-one career coaching. It moves you out of a cycle of exhaustion and self-blame, placing you in a position of empowered, strategic career navigation. If you want to thrive in modern healthcare, clinical skills will get you hired. But to build a career that lasts, you have to step beyond clinical excellence and embrace strategy.